The device itself is really easy to mount because it's on a standard needle. You literally just pick it up and mount it onto the syringe. It's always good to just check that the needle moves freely within the device itself, and then prime in the usual way. You'll find that when you prime the needle, a little bead of fluid presents itself just at the top of the device, and that's quite normal, and then you're ready to inject. When I carry out an injection, I tend to ask the patient to look down. I usually stand at the top. I'll ask the patient to look down and I'll pull up their top lid using my non-dominant hand, and then I line up the inner curve of the device at the limbus, which automatically places the needle at 4 millimeters, and the foot plate firmly down on the conjunctiva. And then in that position I know that I'm safe, and I can advance the needle into the eye, and then I can let go with this hand. The needle shaft is protected by the foot plate, so there's no chance of contamination of the needle shaft, and then I can inject my drug into the eye before coming back out again. And that's the injection completed, and then the normal post-injection drop regime that your center likes to use can be started. It's also possible to lock the device to make it sharp safe by squeezing the arms together and displacing it. And so if sharp safety is of concern, or if you're delivering injections out in the community without sharp spins, then you can make the device safe before transporting it back to a center to be disposed of safely.